Hi, everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Welcome to our community. We thought today we'd talk about brain fog and COVID-19. It certainly does feel like we're beginning to see the light at the end of the tunnel with COVID, but for many people, they have experienced a symptom called brain fog. And for some people, it's lasting quite a long time. So we thought we would seek out expertise on the topic of brain fog. And joining me now is Kristen Willeumier. She is an independent researcher and who was trained at UCLA. Kristen, thanks so much for joining us.
It's a pleasure to be here. Thanks for having me.
So I have to tell you, I've been thinking a lot about the neurological symptoms of COVID, and just in terms of the fact that, Being Patient is dedicated to both brain health and dementia. But I keep thinking if we can maybe solve a piece of the brain fog equation, maybe, just maybe, it will open the door to help accelerate research with dementia. Is that far off the mark? Is that just wishful thinking?
I never think that kind of a question is wishful thinking. I actually think, number one of the blessings of COVID, if we could say there is a blessing, is it's getting people to think more about taking care of their brain health. And by taking the steps to take care of their brain health now, they will prevent dementia. Because really, dementia is preventable. It's 90% diet and lifestyle, 10% are related to the genetics. So again, this is where we've got people who are struggling with COVID. We've got the long haulers who have various psychiatric and neurocognitive issues. And it's getting people wanting to investigate more. What do I do? How do I take care of my brain health? Because I don't want to live like this. And instead of waiting until we're 65 or older and we get the diagnosis of a degenerative disorder, we can think about, taking care of our brain health now, when we're in sort of these earlier stages.
Okay. And so from a neuroscientist perspective, how do you define brain fog?
Brain fog is really just a constellation of symptoms. So it could be headache, dizziness, inability to concentrate, inability to remember things, a malaise or fatigue, low energy. That's what we think of brain fog as. So for each person, it could be different, but it's just that inability for your mind to really function efficiently.
And, I know some people are experiencing problems with smell and taste, and that's a neurological symptom, if I'm not mistaken, too. Is that right?
Correct.
Could that be also classified under brain fog, or is that something different?
Well, with COVID-19, we're finding that one of the primary routes of entry into the central nervous system is through the olfactory epithelium. And then it leads back into the nasal passages and olfactory bulb and can get into the brain. So that's one way. The other way is with COVID-19, you have this systemic inflammation that can degrade the blood-brain barrier, and the virus can potentially get in that way. So the brain fog can be coming really from the inflammatory processes that are happening. And truth be told, when that happens, so our brain is one of the most sort of metabolically active organs, right? It weighs 2% of our body's weight, but it consumes 20% of the brain's oxygen and energy. And so when we have this systemic inflammation, the antioxidant systems that are usually there to help protect it are overwhelmed. And that's sort of part of the reason why we can use certain dietary approaches, anti-inflammatory diets, to really help address some of this brain fog and fatigue that people with COVID are experiencing.
Okay, I want to go into the therapies that we could apply, but first I want to really understand the inflammation, because I mean it's like all roads of evil kind of lead to inflammation, right?
Yeah.
It certainly feels that way. So when we talk about Alzheimer's dementia, we talk about the beta amyloid plaque, and then the tau tangles, and then your brain reaches an inflammatory state, which is when people actually notice symptoms, and before that they might not. So my question is, is this like the same kind of inflammation in the brain? Is there just one type, when we hit our knees or, get a bump, it's like that same type of inflammation, that bruise. Is it the same type of inflammation we're talking about inside the brain?
Great question. So when you bump your knee or get a bruise, you have this acute inflammatory response, and it really focuses right on that area to help get blood flow and help to heal that particular area. When we're talking about an Alzheimer's type dementia, when you have the accumulation of these beta amyloid plaques and tau tangles that really start, decades in the brain before you have a symptom, that's where the inflammatory response is a little bit different. And with COVID, the difference there is that you have this massive inflammatory response. It's just so overactive and the body can't handle it. And what's an inflammatory response? So they're the release of what are called cytokines, or pro-inflammatory cytokines. So there's IL-1, IL-6, tumor necrosis factor alpha. So there's all of these cytokines that get released and damage the brain. And again, in COVID, it's a storm. It's just so much that the body can't handle it. And that's where we're getting the brain fog. In the Alzheimer's.
Can you, before you go on, can you define what a cytokine is for our audience? What does that mean exactly?
Yeah. It's just an inflammatory molecule. So whenever you have an inflammatory process, it's just a molecule that, again, triggers the inflammation, and they can poke holes in cell membranes and create reactive oxidative free radicals that damage the cells and the DNA inside the cells.
So when you say it's it's a cytokine storm, and
Right.
So presumably it's like impacting, there's so much blood, so many blood vessels and so much blood flow in our brain. Presumably it's impacting the entire brain. Is that correct? Or is it one part?
It actually impacts the cells, so it attacks the cell membrane. So the lipids that are on the cell membranes can get damaged, and then it can get inside the cells and damage the cells at the level of the DNA. So that's where you really want to have the antioxidant response to help mediate that and calm it down.
Okay, so in COVID, some people, these symptoms are lasting a very long time.
Yes.
We're about a year into the pandemic, and some people have months and months of this. And so is there a way to treat it, or do you have to just wait it out and hope your body calms down?
Well, I love the innate intelligence of the body. I always tell people, if you eat a clean diet, right, and get restorative sleep and modulate your stress levels. Some of the basics that we always hear about, I do feel that your body can handle it naturally, but there are some things that we can do to help it and make it a little bit easier on the body to be able to heal and restore naturally. I think with COVID, we've got people are having these symptoms, as you said, for weeks or months. And some people, the long haulers, are probably still, you've got people who still have it even a year. Here we are getting in the year sort of anniversary, if you will. And I think we also have to look at what other comorbidities or things that they might be dealing with. So we're seeing that older populations are more vulnerable to COVID because they might be overweight, have cardiovascular issues, have had a stroke. So we also have to look at those other factors. We're thinking about helping people who are the long haulers. The harder part is that you're also seeing young people, who are long haulers. So I think that's really saying something about the systemic inflammation and how long it's taking the body to be able to handle this.
Do you think that brain fog could possibly accelerate symptoms of dementia? Because if someone already has beta amyloid plaque or tau tangles in their brain, but hasn't yet reached that inflammatory state, but then gets COVID and is forced into is it the same type of inflammation that you would see or can it accelerate dementia?
It absolutely could accelerate the symptoms that people who have dementia feel, because a lot of these diseases of aging are chronic inflammatory diseases. So, COVID on top of it is sort of like the double hit. which is why we really want to make sure those older populations are protected.
So in terms of calming down the inflammation, specifically, are you like, what's the latest research out there? What helps? What doesn't? Do we know yet? And I mean, you mentioned, kind of looking for comorbidities that can accelerate that. But what else? Is there any other research that indicates how we subside these symptoms of brain fog?
Well, first you address the, treating the COVID with the antiviral therapies, or some people are using steroid therapies to help. And there's a lot of support from certain nutritional approaches, not just diet. Well, I think diet is actually one of the smart strategies people can use. Following a Mediterranean diet can actually help improve cardiovascular health and reduce the onset of neurodegenerative decline. So I like people embracing a Mediterranean diet, properly hydrating, thinking about the use of smart nutritional supplements. We've all heard vitamin D can be very helpful, or at least making sure your vitamin D levels are managed, because that helps to reduce or support your immune system. So we've got that, we've got zinc, we've got vitamin C. So I think there are some very basic things that we can all do at home to help protect our brain. And then there are things if you're still struggling. If you have symptoms like anxiety and depression and some of the neuropsychiatric comorbidities, taking things like omega-3 fatty acids can really help to manage mood, because that's the other piece. People talk about brain fog, I can't think, I can't concentrate. But there are also, comorbidities like anxiety and depression that need to be addressed. And, having worked in a psychiatric clinic with, lots of people who struggle with those symptoms, that's sort of this other piece, this mental health piece that I think also needs to be addressed. And we don't know people who have COVID. We're still trying to understand sort of the long-term, the long-range tail of the mental health issues, and can this lead to degenerative diseases later on down the line?
So do we know how? I mean, what is the average for the long haulers? Like, what's the average this symptoms lasting, or is it in many of the cases is it really not treatable, or what?
With long haulers, I think symptoms will eventually resolve. I think that's the good news, but depending on where somebody is at on that spectrum, are they young and in their 30s and were healthy before they got COVID? They're going to bounce back a lot quicker than somebody who's older and has multiple comorbidities. And again, that's why the older populations are the ones that tend to be more vulnerable, that tend to be hospitalized, and those are the ones that we see in our morbidity and mortality statistics. So,
and we have a question like, why do some people develop neurological symptoms but not others? And how common are severe symptoms like stroke and encephalopathy?
Yeah, it's a great question. So what the research showed coming out of Wuhan, China, sort of one of the first big studies out of 214 people, approximately 30 to 36% of people had neurological complications. So the primary neurological symptoms, as you've stated earlier, loss of smell, loss of taste, headache, the brain fog. Certain people are at higher risk for stroke, because not only are we having that chronic inflammation, but it's increasing the ability of the blood to coagulate. So if you're high risk for stroke, or you have cardiovascular issues, that's a concern. And then a smaller percentage of people are having the encephalopathies, the peripheral neuropathies, Guillain-Barré, but those are rare. That's not a large percentage of the population. And what the autopsy studies are showing, it's actually kind of fascinating. I just read a paper on 149 cases of COVID-19 patients. In the autopsies, they found that 65% of those patients did not have any issues in the brain, which I actually think is really promising. So we're trying to get a better understanding of what's going on in the brain. And for the 50 patients that did have brain issues, you're seeing hypoxia in certain areas, especially in the hippocampus, which is
What
an
is
area.
hypoxia? Can you define
Oh,
that?
hypoxia is low level. It's neurons die from low levels of oxygen. So death through the hypoxia, or you see certain brain regions in the brainstem that have been affected or have the SARS-CoV-2 mRNA there. So we're seeing it does get into the brain. It's sort of diffusely spread, but it's not in all cases. So I don't know that, we don't really have a target area. So if somebody comes in and gets COVID-19, it's not like we're looking at a very specific brain region. Is it here?
So are you participating in the studies right now? Tell us where you're at. Are you seeing COVID patients?
I'm not seeing COVID patients. I'm a neuroscientist, so I run clinical research studies. And, the clinic that I was working in, all of the people that we see, again, we're doing Zoom consults and still staying fairly separated, but we're in California. So it's, one of those places where the restrictions are still pretty
pretty in place. So
yes, everything's in place. We're still trying to be, socially distanced, but what I actually feel like we're turning a corner.
Yes.
To be honest with you,
I
feel like there's a light at the end of the tunnel. I mean, 60 million people have received their first vaccination. 30 million people have received both. We're easing restrictions. People are getting healthier. So I'm actually optimistic and really sort of, excited about the future and us being able to get back to.
And speaking of vaccines, a question has come in, could COVID vaccines aggravate brain fog?
That's a good question. And I think we don't fully have the answer yet when we're looking at the side effect profile. The side effects seem to be very minor in people, like, bruising at the injection site, minor fatigue. I think for some people it probably could, but, I'm not seeing that in the data that's coming out now, which is actually very encouraging.
Yeah. And so do you feel like we can, what insights can we get in exploring brain fog to really understand specifically inflammation in the brain? What are we looking for exactly?
Well, I think one of the main takeaways here that people can understand is, when we think about inflammation before COVID-19, just understanding inflammation in the body leads to pretty much every chronic and degenerative disease, from cancer, stroke, Parkinson's, Alzheimer's. So I feel like it's going to make people think more about what they're doing, their dietary and lifestyle habits to help reduce inflammation in the body. Even having excess weight on your body is inflammatory and can damage the brain. So we've published research on that. Even healthy individuals that were overweight, having excess weight on the body damages neurons in the brain, especially in the frontal lobes, which is the area of the brain important in higher level cognition and judgment and reasoning. So I think we can think more about, okay, inflammation is not good. And, what kind of things cause inflammation? Simple as having a high sugar diet or too much saturated fat. I know it sounds so simple, but, doing things to bring down inflammation in the brain and body is really what's going to protect your long-term cognitive health.
So do we know, though, that presumably people who are overweight are more susceptible to these symptoms?
Yeah, they're more susceptible. And there was some research that came out that was saying people who are overweight were a higher percentage of people having symptoms associated with COVID. So, this is one of those, and maybe somebody like me who's, involved in the brain health field. And we always say, a revolution in brain health, a revolution in mental health begins with brain health and brain health practices. So, when you were asking what can we learn from COVID about the brain fog and these sort of neuropsychiatric issues that are going along with it, I'm hoping that it just empowers people to really think about the lifestyle choices that they can make now that will help protect their brain and even slow down even if you have a degenerative process in your brain. I mean, I've worked with patients who have Alzheimer's, Parkinson's, frontotemporal lobe dementia, and we still work with them to take care of their brain habits, right? It's all about, what you eat every day. Are you moving? How much sleep do you get? Doing your lab values, making sure everything's optimized so you have all of the proper nutrients for your cells to function efficiently.
So I have to ask you about the smell. Any insights into the loss of smell? Is there something that brings it back? Does it eventually come back? Or, I've read about some people having it for months.
I know the loss of a sense of smell is a little frightening. It's a little frightening, isn't it? I will tell you personally, just an aside, my grandmother had gotten into a car accident when she was 17. She went through her head hit the windshield. She lost her sense of smell and never regained it. She lived to the age of 95. Wow. She never regained it. And, now I'm looking at people who have this issue with loss of sense of smell. The great thing is most people, majority of people, I want to say 96% get it back relatively quickly. I think it's when the immune system is able to handle the virus. You're able to get your sense of smell back. And I think we're just still trying to understand how the virus is acting in the brain and body. And again, we know because that spike protein is binding to the ACE2 receptors in the nasal epithelium, that just seems to be one of the portals that it's using to get into the brain. So thankfully, our body's able to handle it.
Yeah, that one would be a real horrible one to. Talk about take the joy out of eating and tasting.
And life. That's why I think I think people are more afraid of that loss of taste and smell. When you're in your 20s and all of a sudden, that's a wake up call.
Yeah. Well, Kristen, thank you so much for joining us. It's a really interesting topic, and I'm sure as we evolve and learn more about COVID-19, there will be other insights about the brain picked up along the way. Don't forget about us. Come back and share it with us as you continue your research. But thanks very much for your time and coming on and sharing your insights.
Oh, it's such a pleasure. Thank you for having me.
So if you want to know more about brain fog and this topic, we're going to post the interview on our website, beingpatient.com. Don't forget to sign up for our newsletter on beingpatient.com. There's a big form to sign up because that's where we're going to let you know about upcoming talks related to the brain, not only dementia and Alzheimer's disease, but also brain health. We go to the leading experts and we talk about where research is. So it has an angle for really everyone. So thanks very much for watching, and we'll see you next time.